Laurence Kemp. Laurence studied medicine at the University of Cambridge and graduated in 2005. Following practice as a specialist GP, he went on to become medical director for a group of primary care clinics. In 2018, Laurence moved with his family to Brisbane, Australia, and this is where he first developed his interest in medicinal cannabis. Laurence now leads the Can I Help group of clinics, as well as continuing to work part-time as a GP and sitting on the Brisbane South PHN Clinical Advisory Board. Laurence, thank you for joining us and joining us at Pure Health Hub. I sincerely appreciate it.
It's my pleasure.
Now, public interest in CBD and its sister THC is soaring. Google search rates grew 400% between 2016 and 2019, when CBD was the fourth most searched health-related topic. And it shows no sign of slowing down. So why has interest skyrocketed, do you think?
I think there's probably a number of factors in that. I mean, I think I always start by taking a historical perspective. You know, cannabis as a medicine is nothing new. You know, it's been around for thousands of years. There's evidence that it was one of the earliest plants that was ever cultivated by early civilizations. And it was recognized over 150 years ago as something of medical interest in textbooks that were written at the time in the kind of mid-19th century. So there's nothing new about cannabis. There's been throughout most of the 20th century, there was a period of prohibition, and you know, it was just not something that was used commonly by the medical community. And then we saw in 2016, Australia allowed cannabis to be prescribed under certain circumstances for certain patients, and so I think that really was the birth of the medicinal cannabis industry in Australia. And I think we're very much in that kind of early phase where people are developing an interest in the health benefits of this plant, and you know, we're seeing increased interest and increased number of patients coming in month by month at the moment.
Yeah, it's interesting, isn't it? Because it is, I mean, it has been around for, as you say, well, hundreds of years at least. And as you say, why did we sort of put it to the side? Was it because of its psychoactive properties, I guess? Was that what happened?
Well, you know, I think certainly that was an element of it. I think my understanding of the, you know, I'm not a historian, but my understanding of the history of all of this was that actually there were a number of political and social factors. I think hemp was a big competitor to cotton, which was, and obviously the US at the early part of the 20th century had a thriving cotton industry. And I think part of the prohibition of cannabis was around kind of, you know, protecting the flourishing cotton industry there from competition from hemp. So that may have been part of it. But you know, it is interesting that in the 19th century, cannabis was a very well established treatment, and you know, then really fell into disuse through most of the 20th century. And it's only recently that we've there's been significant research into it, and we're really understanding about exactly how all the components work and the benefits that we can get from that.
Yeah. Well, I'm hearing all the good things, and in fact, I'm the recipient of some of those good things. So I've personally been prescribed both CBD and THC for chronic pain primarily, and have been taking CBD for about 4 months. Now, my experience is that I love CBD. It has not been as effective for the pain relief as I'd hoped, although I'm sure it helps with that. But for me, it's had an enormous effect, a positive effect on my anxiety levels. You know, I really feel like it's turned it around for me. So for that reason alone, I want to continue to use it. But what other types of conditions are they prominently prescribed for, both of them?
Yeah, so I think if we look at the data we got from our clinic, probably about a third of our patients, their primary problem is chronic pain, and you know, that's often musculoskeletal pain. Sometimes that can be nerve-related pain or migraine, and occasionally pain related to cancer or the side effect of cancer treatments. So that probably encompasses about a third. About a third of our patients would have either anxiety or depression as their predominant complaint. And the other third of patients is, the kind of group with what I would class as the miscellaneous group. So that has a number of other conditions, particularly post-traumatic stress disorder, chemotherapy side effects, neurodegenerative disorders like Parkinson's disease, multiple sclerosis. I have a number of patients with epilepsy, which is obviously one of the more established uses for medicinal cannabis. I think that those were probably Parkinson's disease, if I didn't mention it. So a variety of them, and some children with autism or autism spectrum disorders as well. A small number of patients in that cohort.
Wow, so it's a broad spectrum, isn't it?
It's got an awful lot of uses.
It really does. And when I said about the pain relief, it may not have been, but then it will often, obviously, I'm guessing it depends on how much you take, right? Yeah. I mean, it depends on, what you're prepared to sort of take that,
I think the thing with cannabis is, I think we need to learn to think very differently about this as a medication. And as I explain to my patients, usually when you pick up a prescription from a doctor, what you're being prescribed is one chemical compound in a pill. So, most painkillers would just consist of one drug, in a tablet or in a capsule. With cannabis, what you're dealing with is a plant extract, and we talk about CBD and THC because those are the two major ingredients. But so far, we've identified over 100 compounds within that plant which have some pharmacological effect on the body. So there are a variety of what we call minor cannabinoids, and then these chemicals within the plant called the terpenes, which are what give cannabis its smell and its taste, and they also can have various effects on the body. And so it's far more complex than just a single ingredient. The way I talk about it, it's kind of like a cake, and depending on the precise components of all the different ingredients and how it's grown, it can have very different effects. And so part of the art of using cannabis well medicinally is about getting that balance right. How much CBD, how much THC, what kind of strain do you need, what are the other components that are in there, and it's a very individualized treatment. And I think absolutely, CBD is what's being very well publicized at the minute. Yeah. I think that can work very well for certain conditions, but for other things, like you mentioned with the pain you've experienced, often an element of THC and the right balance of these other ingredients is necessary to really treat that effectively.
But if I can just talk about that THC, I didn't really enjoy the THC because it sort of took me back to a young teenager, really. So I wasn't happy. So it's not something that I will continue to use. And I don't know what I thought. I think I must have thought that perhaps, it had the THC element, but then it didn't have the psychoactive element. So is that always the case?
So THC is the main ingredient within cannabis that has the psychoactive properties. So I think a lot of my patients have previously been using recreational cannabis, and obviously most people that grow recreational cannabis grow it to be very high in the THC strain because that's why people buy it. Generally using it medicinally, so certainly the THC can have some favorable properties, particularly in dealing with nerve-related pain. If you co-administer it along with some CBD, either with a strain that's got some CBD in it or giving that separately, often you can reduce a lot of the unwanted side effects, the sedation, the kind of feeling of a high. So through dosing it appropriately and also looking at how you dose at different times of the day, the kind of goal of the therapy is really to treat the pain or the condition you're treating as effectively as possible, and minimizing those other side effects. So
it's super important, right, to get this right. I mean, my GP, and bless her cotton socks, she's incredible, but she only just started to take on prescribing MC. So she was going along and we were learning together, right? But it's really important to get that balance right, rather than
I think it is, and I think it's one of these areas that most GPs in Australia are not overly familiar with it.
Yeah.
A lot of them have been really put off prescribing it because of the administration and the bureaucracy that goes around it. So I generally find when when GPs refer patients to me, it's usually because they're actually quite supportive of the patient trying it, but they just don't feel they have the expertise or the time to do that themselves. The philosophy I always take is, if possible, I like to work closely with that patient's own GP. I think it's generally better if you can, if a patient has got a GP that they've known for a long period of time, who knows the background to their problems, that person is usually better placed to assess how well that therapy is working than someone like me that that comes in and doesn't have that relationship with the patient. So I'm kind of there as a source of advice to people, but I also take on that aspect of patient's care when their GP doesn't feel sufficiently skilled or feel they've got the time in order to do that.
And is the Can I Help group of clinics that's there really to also help educate the health professionals?
Yeah, absolutely. The way we work really is we work with GPs who have an interest in prescribing cannabis. We provide resources, we provide education, and we provide nursing support, so that when patients are referred to our group of clinics, we offer a free consultation with one of our nurses who can talk with that patient, work out whether cannabis is going to be a suitable treatment for them, and then we can pass them on to one of our network of GPs who can undertake a formal assessment. So we spend a lot of our time discussing with general GPs and doing educational sessions, probably as much time as we do working directly with patients.
Yeah. Well, it's fantastic, obviously, that it is that companies like yours and organizations like yours are there. So the difference between CBD and THC and what they're individually used for, I guess we've touched on that, but can we use them together?
Yeah, no, so absolutely. So I think that CBD and THC are the two main components of the cannabis plant. CBD is not psychoactive, so it won't make you feel sedated. It doesn't get you high. It has no impact on your reaction times, and it's fine to take CBD only medication when you drive. THC is the psychoactive component. So CBD is predominantly used for conditions like anxiety and depression and sleep disorder. It has some anti-inflammatory properties, so it can be helpful in some types of pain. For THC, we use that more in patients with degenerative or nerve-related pains, and that seems to be particularly helpful in patients with post-traumatic stress or with severe anxiety that's affecting their sleep as well. So they're kind of two components, and we almost always co-administer them. Sometimes we'll go for pure CBD, but generally in my practice, if I'm giving THC, I'll always try and give some CBD along with it as well.
Yeah. So there is a complementary element there, isn't it? So what forms do they come in?
So in Australia, the main forms that we've got are oils and dried flower, and more recently they've introduced some wafers onto the market as well, which have slightly different properties. So I would say the majority of prescriptions are for oils. So what this is extract of the cannabis plant that gets dissolved in a carrier oil, whether that's olive oil or coconut oil or
right.
And those oils, you can have a very precise concentration of the cannabinoids, so you can dose them very accurately, and they're taken orally. The dried flower is another commonly used method. So this is where you put some dried cannabis flower into a vaporizer. You heat it up to about 180 degrees, and that allows all of the cannabinoids and the terpenes to be to form into vapor, and then you can inhale that. So oils take a couple of hours to work and last for about 8 to 10 hours. So they're good for patients that have symptoms that need managing throughout the day, and you can dose that 2 or 3 times a day and get very good coverage. The real advantage of using a flower is that because it's inhaled, the onset of action of that can be within a few minutes. So that's particularly helpful for patients that get severe bouts of pain, particularly cancer patients who may have pain that fluctuates very quickly in severity. So they need something that acts quickly. And again, for severe anxiety and post-traumatic stress, sometimes the ability to have something that acts very quickly can work well there.
Yeah.
Yeah.
Particularly if they're going into some kind of panic attack or something, I guess.
Yeah, I think things like panic attacks are obviously extremely unpleasant, and if you can't wait 2 hours for your your medicine to begin to work there. So that really quick acting preparation can be a real advantage in circumstances like that.
It's so reassuring to have something like this now. Now, of course, coming back to Pure Health Hub, what are there specific benefits for women, particularly women in that 40 plus, 45 plus, menopausal, perimenopausal, postmenopausal? Are there some benefits there?
Yeah, so I think this is a really interesting question, and this is an area that's been actively being looked into. I mean, I think one of the things that we do know is the receptors for cannabinoids, particularly what they call the CB2 receptors, which are the ones that interact with CBD, that are found in very high concentrations in the female reproductive tract and in the urinary tract there as well. So we know that the cannabinoids act on these areas of the body, but we're not entirely sure as yet as to the effects that they have. I think certainly in that perimenopausal period, conditions like sleep disturbance and anxiety and temperature dysregulation, are all quite common features.
Yes.
And we know that that CBD and other cannabinoids can potentially have a beneficial effect on those. There have been a few studies that have reported beneficial effects of a cannabinoid medication on sexual function and levels of sexual arousal. But that's something that hasn't been subject to kind of large-scale studies as yet.
Get onto it. Tell them to get onto it.
I think these are active areas of research. So I think the short answer to that is, we don't know exactly how these medications within cannabis interact with the hormonal system, but there's good reason to think that there are some effects there, and certainly a number of the conditions do appear to be amenable to treatment with cannabinoid medication.
Well, that is good news. Us women can do with everything we can get at this particular process through life. We've kind of answered that question though, because I was going to ask you about the female hormones and the impact on that. But the inflammation on the body, you mentioned it before. So has there been anything sort of indicating that it can reduce inflammation? Yeah,
so I mean, CBD in particular is thought to have some anti-inflammatory properties. It's certainly there's some evidence of benefit with conditions like inflammatory bowel disease and conditions like rheumatoid arthritis, which are inflammatory. So certainly it can mediate inflammation. And I personally, I've had some patients that have come to see me with endometriosis causing chronic pain like that, and they've actually had some significant benefit from using CBD as well. So I think there are some anti-inflammatory properties going on there with CBD as well. But again, we're still kind of in our infancy with how well we understand all of these things at the moment.
Well, exactly. But at least we can watch this space, and as long as we're being active, and the research is there, it's good to hear. But even that early sort of indications are great. Now we know that we understand the use of medicinal cannabis has been legalized here. So why don't we have access to it without a prescription? Yeah,
so this is a complex area, and it's something that I get asked an awful lot by my patients actually. So what we've seen in the last year is that CBD only medication, or medication that's predominantly CBD, has been descheduled to a Schedule 3 medication, which means something that would be available over the counter. Unfortunately, for stuff to be available over the counter, they also have to go through a separate licensing process. And in order to be licensed as a drug in Australia, absolutely appropriately, the manufacturer of that product has to provide, quite a lot of evidence of its effectiveness. Now, one of the issues we have in cannabis medicine generally is that if you think about how any other drug is developed, generally a drug company would produce that drug. They would take it through early testing, and then they would invest, hundreds of millions to possibly billions of dollars in taking that through a rigorous testing process with a view to obtaining a license to use that in multiple countries. Now they recoup their investment because they own that intellectual property. And the thing with cannabis is that nobody can own the intellectual property. It is a plant. And so it's very difficult to secure the massive amounts of funding that is needed in order to get these drugs through the testing process. So I think we're in a situation where there's quite a lot of small studies and laboratory studies and low small scale clinical data demonstrating effectiveness for cannabis in a number of conditions. But in most conditions, we don't have these large scale studies that are required to obtain a license, which is why cannabis is still, despite the fact it's been down regulated as a Schedule 3, we still don't have the required data for it to be, for these products to become licensed. So we're stuck in this situation where these products are available, but they're classed as experimental products, which means they have to be prescribed by a doctor, and that doctor has to seek special authority in order to do them. So it's a complicated area. I think we will see some movement in this over the next 12 months or so. And I think certainly if we look at what's happening in my clinic and elsewhere in the industry, the interest and the use of this is growing quite rapidly. But I think we're still probably quite a long way from it just being readily available over the chemist or being available on a prescription without going through all of these extra processes.
Because it's still costly as it remains on prescription. I'm sure that's going to be the case.
And I think that's the thing, because it's not a licensed medication. It's certainly not being considered under the PBS scheme. So the majority of my patients self-fund. Patients who are veterans are sometimes able to obtain some funding from the DVA. And there are now a few of the health funds that are willing to partially fund cannabinoid medication as well.
Right. Well, that's a good start.
It's a good start. We cost barrier is probably the biggest barrier we still see to this. Can I help? We've actually worked with a producer called Cann who grows cannabis here in Queensland. We offer something called our compassionate access program. So patients with severe health needs, or patients with with adverse financial circumstances, or patients with an Aboriginal or Torres Strait Islander background who would qualify for their Closing the Gap scheme, we're able to offer some subsidies towards the cost of the medicines, which I think can make a big difference. But unfortunately, it's not something we can offer to everybody.
No, I know, but it's fabulous that there is an opportunity there for others to be able to access. That's super important, because it's just prohibitive otherwise.
Well, I think it is. I mean, even say that without a subsidy, our average patient could spend anything from $100 to $300 a month on this, depending on the doses that they take. So that's a significant burden for the vast majority of people. Well,
particularly because often it's not their only medication.
No,
there can be others, and so. Wow, this is, well, for me, I can hear that we seem to be getting closer to one, awareness. I think awareness for me, which was, thank you for coming on to talk to us about it, because I think there's a lot of interest in it, but I think people are still not sure. And it was super important for me because I've found CBD particularly helpful, that we shared this with our readers who are at this age and having their own challenges. So it's good to know that Can I Help is there, and that people like you are driving this message and also supporting those who are growing, right? So I read in your bio that you're helping to, well, not fund them necessarily, but to sort of connect them with funding? Is that what's...
we work in a collaborative way. I think they, Cann were mindful that they were producing this product, and they wanted to see people using it for the maximum health benefit. They didn't have the expertise to assess who would benefit most from it themselves, so they partnered with us to undertake those assessments and deliver that program with them. And so that's a real advantage to our patients, and something we're really proud of.
Huge advantage. Now, to access Can I Help, it's better to go through your own GP and get a referral to come to Can I Help. Is that how it works?
So we accept referrals from any GP. We also accept patient self-referrals. So patients can come to our website, which is www.3ws.
It'll be on the end of the interview, don't worry.
Be on the end of that. So you can self-register for that. There's the option to upload a referral or a health summary if you have one. But if you don't worry, our team will contact your GP with your consent and try and get all of that information prior to your appointment.
Well, that's sounding at least a lot easier for people to access it and certainly learn a lot more. Dr. Laurence Kemp, thank you very much for your time today. I appreciate it.
My pleasure. Nice talking to you.
Take care. Bye.
Bye-bye.